Conscious sedation is produced by the administration of pharmacological agents during a therapeutic or diagnostic procedure. A patient consciously sedated has a depressed level of consciousness, but retains the ability to independently and continuously maintain an airway and respond appropriately to physical stimulation or verbal commands. Conscious sedation allays the patient's fear and anxiety regarding the planned procedure. The objectives of conscious sedation include the following. 1. Alteration of mood. One of the primary objectives is to allay the patient's anxiety and fear. 2. Maintenance of consciousness. The patient should be able to respond to commands and have all protective reflexes intact. 3. Cooperation. The patient must be awake enough to cooperate throughout the procedure. 4. Elevation of pain threshold. Even with the use of local anesthetics for pain control at the procedure site, medications frequently are used to elevate the pain threshold. 5. Minor variation of vital signs. Because protective reflexes are unaffected, the physiologic response should not be altered. With proper administration of medications, only slight changes in the vital signs should occur. 6. Some degree of amnesia. Depending on the dose, some conscious sedation medications provide powerful amnesic effects. So, the patient does not have to be unconscious to produce amnesia. 7. A rapid, safe return to ambulation. Conscious sedation produces a condition where the patient exhibits a depressed level of consciousness. Upon completion of the procedure and adequate recovery phase, the patient should be able to return to his pre-procedure manner of ambulation. So, when properly done, only a short stay in recovery is needed. Your patients will like that. Effective conscious sedation of the patient usually meets most of the above objectives. The primary goal of conscious sedation is allaying the patient's anxiety and fear of the impending procedure. One of the most effective methods of facilitation of conscious sedation is verbal reassurance from the procedural teams. Proper verbal reassurance allows for a decrease in the use of pharmacological agents. Patients often are not informed that they may be aware of pressure because of the procedural maneuvering. Although they may feel no pain, these sensations increase patient apprehension, fear, and anxiety level. Verbal reassurance and patient education before and during the procedure can alleviate or decrease most of these symptoms. Monitoring of patients receiving sedation must include documentation of the following at a minimum of every 5 minutes intra-procedure and 15 minutes post-procedure, or more frequently as condition dictates. A. Pulse oximeter. B. Vital signs. C. EKG monitoring if patient has underlying cardiovascular disease, is undergoing procedures with increased risk of dysrhythmia, for example colonoscopy, bronchoscopy, or anticipated time for procedure is greater than 30 minutes. D. Level of consciousness. E. pain level. F. End-tidal CO2 capnography. Based upon the patient's condition, the physician may order increased monitoring, but under no circumstances will the monitoring be less than what is specified in organizational policies. Prior to administration of conscious sedation, documentation will include 1. Present medications. 2. Current medical history. 3. Vital signs: blood pressure, respiratory rate, pulse, oxygen saturation, level of consciousness. 4. Physical assessment. 5. Allergies and previous reactions to anesthesia. 6. Weight. 7. Last intake of food and water. 8. Informed consent. 9. Assignment of American Society of Anesthesiologists (ASA) classification.